be here to provide you with an update on the nation's progress in testing for COVID-19. On March 12th, Secretary Azar requested that I lead the COVID-19 testing efforts within HHS, including oversight and coordination of the FDA and CDC with regard to testing. Since then, the nation has performed more than 9 million COVID-19 tests, a number far greater than any other country and double the per capita tests performed to date in South Korea. To reach this point, we implemented a phased approach to meet testing needs during mitigation and now during phase 1 reopening of America. Beginning March 20th, we pioneered 41 community-based drive-through testing sites in locations prioritized by the CDC. These sites have been a profound success, testing over 167,000 high-risk individuals and demonstrating a prototype that is being duplicated multifold in nearly every state. Next, the administration leveraged trusted retailers, including CVS, Rite Aid, Walgreens, Walmart, Kroger, and Health Mart, who are now providing testing at 240 locations in 33 states, 69% of which are in communities with moderate to high social vulnerability. To meet the need for collection supplies, like swabs and media tubes, we first secured the global supply chain through a military air bridge. We worked directly with manufacturers to increase domestic production. We collaborated with the private sector and the FDA to validate multiple swab and media types that vastly expanded supplies while minimizing the need for PPE. Finally, we used Title III of the Defense Production Act to further invest in domestic manufacturing to prepare us for reopening. To support the need for surveillance testing during reopening, on April 27th, we issued a new testing framework that also prioritized testing for persons without symptoms who are prioritized by health departments or clinicians for any reason, including screening of asymptomatic individuals according to state and local plans. Next, our federal multidisciplinary team conducted multiple calls with leadership from each state to set state-specific testing objectives. Collectively, states and territories established an overall goal to perform 12.9 million tests over the next 4 weeks. The federal government is able to and will support the achievement of this goal. Specifically, the federal government is shipping to states 12.9 million swabs and over 9.7 million tubes of media in May alone. Last month, we also detailed the location and capacity of every lab machine in every state that could potentially run COVID-19 assays, and our team has worked with test suppliers to match reagents to these machines. Looking forward, between now and the end of 2020, the federal government will procure over 135 million swabs and 132 million tubes of media and distribute these to states as requested to supplement the now robust commercial supply. We anticipate marked increases in current tests, as well as a dramatic expansion of new point-of-care tests, like the first-in-class Quidel antigen test authorized by the FDA just last Friday. Quidel anticipates being able to distribute 300,000 tests per day within just a few weeks. So by September, taking every aspect of development, authorization, manufacturing, and supply chain into consideration, we project that our nation will be capable of performing at least 40 to 50 million tests per month if needed at that time. And if new technologies are authorized, like whole genome sequencing approaches or any novel solutions uncovered by NIH's New Diagnostics Initiative, that number will be much higher. Finally, I want to acknowledge and express my heartfelt gratitude to the officers of the U.S. Public Health Service Commission Corps, the uniformed service I am honored to lead. 3,471 men and women have deployed in support of this pandemic, on the cruise ship in Japan, to our military bases repatriating Americans, to our community-based testing sites and international airports, to FEMA and our task forces, to nursing facilities, including King County, Washington, and to field hospitals and hard-hit communities across our nation. I thank each and every one of these officers and their families, and on their behalf, I thank the members of this committee for supporting our training needs and the establishment of a ready reserve to supplement our ranks in future national emergencies. Thank you for the opportunity to provide these remarks.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.